Hello, my name is Rebecca Oliver, and this is my Capstone and 5-year plan for nursing, 4580 Practicum, Synthesis of Professional Nursing with Dr. Nancy McAfee. My name is Rebecca Oliver. I am an RN working on a med-surg unit at CHI St. Luke's in Livingston, Texas. I graduated with my ADN from Angelina College in Lufkin in May of 2016, and I've worked at this facility on this unit as a floor nurse for 1 year before transitioning to charge nurse in July 2017. I am ACLS and PAL certified. I began my baccalaureate program at Lamar University in the fall of 2016. I am currently completing my final class in this program. When I am done with this program, I plan to pursue a master's degree acute care nurse practitioner at UT Arlington. This program has definitely made me a better nurse and given me a broader perspective about the patients I care for. This slide is the humanity and society construct. The objective was to practice safe and effective, holistic, patient-centered care to a variety of patients, clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This objective was met in Nursing 4550, Leadership and Management in the Healthcare System. The assignment was the Global Health Professional Nursing Organization PowerPoint presentation. The objective was met at 100%. The objective was also met in Nursing 4540, Care of Communities, Global Health Discussion about Diabetes Management and Prevention globally. The objective was met at 95%. Next is the Lifespan Health Continuum construct. The objective for this construct was to support patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This objective was met in Nursing 4620, Care of Patients with Compromised Multiple Health States, in the discussion about care of patients with trauma, compromised immunity, and end of life. This objective was met at 92%. The objective was also met in Nursing 4316, Comprehensive Holistic Health Assessment, where I use the nursing process to assess, plan, and provide care for simulated patients in shadow health. The objective was met at 92%. This next slide is evidence-based practice and clinical reasoning construct. The objective was to synthesize clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. This objective was met in Nursing 4390, Nursing Inquiry, Evidence-Based Practice, in the Quantitative Research Article Activity. The objective was met at 98%. It was also met in Nursing 4620, Care of Patients with Compromised Multiple Health States, in the discussion about evidence-based guidelines or protocols. Objective was met at 98%. This slide is referring to patient-client-centered care. The objective was to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. This objective was met in Nursing 4540, Care of Communities in the Practicum Project, Windshield Survey, and Planning for Disaster Preparedness in the at-risk population of my community. Objective was met at 98%. It was also met in Nursing 4620, Care of Patients with Compromised Multiple Health States, in the Community-Based Service Learning Activity. I was able to meet with the patient, identify patient needs, and provide community resources and a plan for a patient with cardiomyopathy. Objective was met at 90%. Next is the professional roles construct. The first objective was to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. This objective was met in Nursing 4550, Leadership and Management in the Healthcare System, in the Practicum Clinical Evaluation Assignment, where I identified a guideline or procedure at my facility that needed changed. Objective was completed at 93%. It was also met in Nursing 4550, Leadership and Management in the Healthcare System, in the APA paper about leadership and leadership qualities. This objective was met at 97%. The second objective for professional roles was to demonstrate professional integrity, effective communication, active inquiry, and service to the community. This goal was met in Nursing 4620, Care of Patients with Compromised Multiple Health States, in the practicum assignment of a personal memoir, A Body Broken, and an actual patient comparison about living with chronic pain. The objective was met with a 96%. It was also met in Nursing 4540, Care of Communities Practicum Project, where I provided a plan for the at-risk population in my community to aid in disaster preparedness after Hurricane Harvey. This objective was completed at 95%. This last slide is my 5-year plan. Year 1, I hope to obtain acceptance into a master's program for an acute care nurse practitioner. Year 2, I would like to obtain my Med-Surg certification and my RN 3. Years 3 through 4, I will continue my education and my role as a charge nurse, graduate with my acute care NP, and pass state boards. Year 5, I hope to continue employment in my current facility in my new role. That concludes this PowerPoint. Thank you for listening.